Well, today we put the spotlight on premature babies as we mark World Prematurity Day, which actually falls on tomorrow. It's the leading cause of death in children under the age of 5. Every year, around 15 million children are born preterm, and that number is rising. But the great majority of premature babies can be saved. Well, Paediatrician Dr Klaus Leschner joins us this morning to talk about it. Doc, good morning. And thanks for your time this morning. Do we have any stats, any idea when it comes to preterm births in South Africa, how we fare? What are the numbers?
As far as I'm aware, the preterm rate is about 15%. It does depend in which setting you're born. Private healthcare setting, the prematurity rate is probably a little lower than in under-resourced areas.
And what do we know of survival rates of these babies who are born preterm?
Again, in the private setting, if you're born less than 28 weeks, about a 90% survival. If you're in poorer settings, it could be much higher. For example, very underdeveloped countries, the mortality rate for under 28 weeks would be 90%, as opposed to the opposite end of the spectrum.
So, what are the common reasons for a baby being born preterm, for being born premature?
Many reasons. Sometimes infection in the mother, high blood pressure, diabetes. A lot of the time we don't know what causes it. It could be issues with the placenta or other biological factors. Poor areas, poor nutrition. This puts an increased stress and strain on the body, and the prematurity rates are higher.
Well, I see here that there are different there are different categories of preterm birth, and some might be determined, I would say, a danger stage, others not so much if the baby comes a bit early. Can you take us through those? I mean, when would it be, you know, that the chances of survival are
well, very simply, the earlier you're born, the more likely you are to die or to have severe problems going forward. But nowadays, with technology and care in good resource settings, we can mitigate so many of these problems and create the best possible potential for the child going forward.
So what are the challenges? And let's start with the baby who is born less than 28 weeks. What are the resources available here? Do we have, you know, are we well resourced enough to try our best to keep those babies alive? What happens there? And then take us through the different stages as to maybe a child who is 28 to 32 weeks born at that stage. What would be their challenges going forward?
Yes, the smaller the baby, the greater are the challenges. If you're in a private care setting where you often have access to the best equipment and care, then things become much easier. It requires hours and days and weeks and sometimes months of looking after a baby. To paint a picture, perhaps, for example, a 25-week baby is born at weighing about 700 grams. They would need urgent admission to ICU, ventilation. Often we give medication into the lungs to make them more mature. They may require antibiotics. Breast milk is essential. They may spend days, weeks on the ventilator sometimes. And then they would need oxygen, and eventually when they're off oxygen, they need to be feeding properly before they can go home. Along with this is the psychosocial stresses on the family, which is a huge factor. And they need to be supported, and the mother and the parents are essential in the whole care of the child. Breast milk is absolutely essential to care for these babies.
But I mean, and a lot of people say, Doc, and I'm sure it's true, that babies who are born premature and those who survive turn out to be the toughest little kids you'll ever find growing up.
They are incredibly resilient. They've already been faced with adversity from day naught. And they often have talents in different areas. They have great resilience and so much potential. In fact, the Prematurity Day color theme is purple, which represents individuality and potential. Yeah,
because I mean, friends of mine also who've had babies premature, and they thrive once they're out and once they get back in there.
Absolutely.
What are the solutions to the problem we're having with premature births?
I think to create good awareness and for there to be sufficient resources available in all areas, systems in place that can help babies once they're born. But no, it starts even before that. It starts even when planning a pregnancy and antenatal care. If that is done well, then prematurity rates are much lower.
Okay. Well, bear that in mind as we mark World Prematurity Day tomorrow. Thank you very much, Doc, and thanks for the figures and the information. Well, if you do know of anybody who has had a premature baby, just tell them just to hang on in there, because the possibilities are endless. It seems they go on to become tough little ones. Still to come.